Welcome friends. Today we are going to learn one of the reduction techniques for anterior shoulder dislocation. A shoulder dislocation is defined as a complete symptomatic dissociation of the articular surfaces of the humeral head and glenoid without spontaneous reduction. The shoulder joint is the most commonly dislocated joint in the body, and the dislocation, depending upon the direction, could be anterior, posterior, or inferior. Approximately 85 to 98% of all shoulder dislocations are anterior dislocations. Anterior dislocations can be further subdivided according to where the humeral head comes to lie, and it can be subcoracoid, which is the most common, or subglenoid, or subclavicular, or intrathoracic, which is very rare. Here is a case of a 23-year-old young female who came with a history of fall some around 2 years back, and followed by acute pain and inability to move her left shoulder. Here we can see that the rounded contour of the left side of the shoulder is lost, which is called as squaring of the shoulder, and the patient is unable to touch the opposite side. It's very painful. This is called as Dugas test, which is positive in this patient. From the side we can see a relative hollow beneath the acromion process. Also we have to look for sensations of the axillary nerve. This is Hamilton ruler test. Here the test is positive, as we can see the tip of the acromion can be joined with the lateral epicondyle of the humerus with a straight line. Here I am using an X-ray to join the 2 points, the tip of the acromion with the lateral epicondyle. This is the normal side. Here we can see that the tip of the acromion cannot be joined to the lateral epicondyle in a straight line. This is the antero-posterior X-ray of the left shoulder joint, which shows a dislocated shoulder joint, and here the humeral head is lying beneath the coracoid process of the shoulder joint. So this is a traumatic subcoracoid anterior shoulder dislocation. Now I shall demonstrate close reduction of anterior shoulder dislocation by Madsen's traction counter-traction method. The patient is placed supine on a table, and here I am putting a cotton ball in the patient's axilla. The patient is asked to relax and take deep breaths. I am not using any sedation or any muscle relaxant. I am using a surgical drape sheet and folding it, and I am wrapping it around the patient's chest and axilla. With the arm straight, the surgeon has to hold the affected forearm with both hands and then lean backwards and apply the traction force. Simultaneously, you have to have an assistant who has to lean backwards, creating the counter traction force. We have to apply a slow and a steady traction and wait for a few seconds. Once the reduction is achieved, you can hear a clunk sound, and immediately the patient becomes pain-free. Post-reduction, the patient becomes pain-free. One can see that the normal rounded contour of the shoulder is restored, and the patient is comfortably able to touch the opposite shoulder. And also from the side, one can see that the hollowness beneath the acromion process is also gone. Post reduction, the patient's close reduction is maintained in a shoulder immobilizer, which the patient has to wear for 2 to 3 weeks. This is a post reduction anteroposterior check X-ray of the left shoulder joint showing a concentric reduction. Thanks for watching.